Fat Ass 45 was a liar, which we already knew. Before he became squatter, Fat Ass 45 lied about everything from his personal wealth to his TV ratings, and to the number of floors that were in his condo towers. Once Fat Ass 45 started squatting in the White House, he started lying about the size of his inauguration crowd, and supersized his lies from there. So now that Fat Ass 45 has tested positive for the coronavirus, who are we going to turn to and trust for information about the state of his health? For many, in the very near term, we are triangulating. There are the official pronouncements from Fat Ass 45 and his White House circle, and there are reports from outlets with good access to Fat Ass 45's orbits. We can combine the two and add in what we know about COVID-19 and get a decent idea of what might actually be happening for the moment. Early Friday morning, NBC, the New York Times, and other outlets reported that Fat Ass 45 was experiencing mild symptoms from the disease. Shortly after that, the White House Chief of Staff Mark Meadows said the same thing on the record. After Meadows spoke, Fat Ass 45's skank wife, Melanoma, tweeted that she had the same symptoms. But that status, where we're able to share a common reality, is shaped by a combination of official pronouncements melded with independent reporting, and it won't last long, if at all. Part of it is because we haven't had a common reality for some time now. Americans who face the news get their news from Americans who follow the news get their news from different sources, which shapes their perceptions of basic facts. Most Americans don't follow the news at all, and an alarming number of people get their understanding of the world from the internet, where very sharp armchair experts sit side by side with deranged conspiracy theories. And some of it is because Fat Ass 45 himself has conditioned us to not believe a single thing that he or anyone in his orbit says. This is the scenario, a fast-moving potential catastrophe where we need real faith in federal leadership, and that we've been worrying about since the days of the Fat Ass 45 squadancy, when then the White House Press Secretary Sean Spicer hectored reporters and insisted that they had falsely reported on the size of the crowd at Fat Ass 45's inauguration. This was a petty claim, and one that was chilling because it was so easy to debunk it. If you start your squadancy lying about something so transparently false, what does that mean when you talk about stuff that we can't see with our own eyes? And it has continued through then, and at more or less a daily rate. Fat Ass 45 and a circle lie reflexively. They lie about enormously consequential stuff like Fat Ass 45's repeated assurances that the coronavirus wasn't anything to worry about, though he was privately acknowledging that it was deadly stuff. Most recently, the Fat Ass has repeatedly lied about the threat of election fraud and a transparent attempt to sow doubts about the results of the members' election. And they also lie about the smallest things. This week, Fat Ass 45's press secretary Kayleigh McEnama falsely claimed that the dumb cunt Amy Coney Barrett, Fat Ass 45's nominee for the Supreme Court, was a Rhodes Scholar. She'd never received the prestigious Rhodes Scholarship, but instead she graduated from Rhodes College. Getting accurate information about the health of the Fat Ass of the United States has always been a problem, both because Fat Ass 45 and his advisors weren't eager to tell anyone that America's leader may be unwell, and because reporters around them often kept quiet. Now, let's take this back to Franklin Roosevelt. Franklin Roosevelt, for instance, asked photographers not to publish images of him struggling to walk because of polio-induced paralysis. Reporters like Leslie Stahl kept concerns about Ronald Reagan's mental fitness to themselves. Years after leaving the office, Reagan announced that he did have Alzheimer's, but he never indicated whether it affected him at the time. Those kinds of questions about a fat ass's health, about the fat ass's health, basically, would be nearly impossible to keep quiet today because we're in a much different media environment with a much more aggressive press and much more access to information. But even now, we know that we've known very little about Fat Ass 45's health. Recall, for instance, the letter that Fat Ass 45's private doctor released in 2015, announcing that if Fat Ass 45 was elected, he would be the healthiest individual ever elected to the squadrancy, which he wouldn't be. It turned out that Fat Ass 45 doctored that letter himself. More ominously, Fat Ass 45's unplanned and still unexplained visit to Walter Reed Hospital nearly a year ago. But past presidential health concerns, including Fat Ass 45's dissembling about his own status, were also long-term problems that didn't necessarily have to be grappled with immediately. Now, though, we have a real-time crisis. We're well aware that Fat Ass 45 has a disease that's particularly deadly for overweight fat ass like him, but we have no reason to trust anything the White House says about the state of his health. And what happens if Fat Ass 45 is truly incapacitated or worse? Who will we turn to trust to relay this information? The one The one saving grace about the Fat Ass 25's administration attempt to conceal the truth from the world about everything is that it has been terrible about it. Some of the lies, like Spicer's crowd-sized fiction, can be debunked right on the spot. Others are quickly surfaced by the many leakers in and around the White House who relay different versions than the Fat Ass 25 dictated reality to reporters. And some become clearer over time, like Bob Woodward's recent book Rage, which I brought the other day, which meticulously details Fat Ass 25's lies about the early months of the pandemic, using taped on the record conversations with Fat Ass 25 himself as the primary source. But even top medical professionals with the state-of-the-art equipment and unlimited resources, the ones who will be caring for Fat Ass 25, now run up against the limits of knowledge when trying to assess someone's health, and that's even more true with the virus that we're still learning about less than a year after surfacing in China. And it certainly isn't something the general public can assess on their own. Even if Fat Ass 25 appears in public at some point to assure us, we won't have any idea what's actually happening or happening to him. So we can only hope that Fat Ass 25 tells us the truth, which I don't see any reason that he would. But there's no reason to think that will happen anytime soon, and we can also hope that reporters in and around the White House can provide a more accurate understanding of what people in and around the White House think is happening. But fundamentally, we're going to be in a haze, hoping it all works out. It's a terrible place to be. Yeah, I wouldn't expect Fat Ass 25 or the White House to even tell us the truth about anything, so that's asking for a near fucking miracle. So if you like the video, give the video a like and subscribe to my channel, Random Mike, and also hit the notification bell so that you'll be notified when a new video comes out, and thanks for listening.